Welcome. My name is Melissa Robinson, and the community I assessed was King County, Washington. King County, King County is a popular place to live in Washington state. King County is unique because it has cities that are high density, such as Seattle and Bellevue, and many rural areas on the outskirts. Income levels vary greatly throughout the county, along with health inequalities. 170 different languages are spoken within King County. There are over 40 hospitals within the King County boundary. There are also many resources for people that need help finding housing, rides to medical appointments, rent assistance, and basic needs such as food and clothing. Opportunities for education include trade schools, community colleges, and four-year universities. Many large tech companies such as Microsoft, Amazon, and Google are in King County and employ many people. King County is the most populated county in Washington and comes in 12th for the most populated county in the United States. There are 10% of the population living at or below the poverty line, and 72,000 is considered low income for a family of four. The relationship between high housing prices and homelessness is a true issue for the King County area. Median age in King County is 37. Individuals with high school diplomas or higher is 93%, and those with bachelor's degrees or higher is 50%. Many races and ethnicities are represented in the community. A windshield survey was performed in King County, Washington. North, South, and East King counties were traveled and surveyed. The East Side has more upper-class neighborhoods, while the South has more working-class neighborhoods. There is a larger presence of police in southern King County and downtown Seattle compared to the East Side. The West Side has more liberal views, while the East Side is more conservative. There were many public parks and community centers, including swimming pools for families to use. There were many off-leash dog parks, outdoor tennis courts, and soccer fields in all parts of the county. Most areas were well maintained and updated with newer play equipment. Many parks in Seattle did have a large homeless population that were sleeping on benches, and abundance of tents were set up all over the city. There were also an abundance of restaurants and shopping opportunities and well-lit sidewalks in most areas. Many grocery and drug stores. Transportation options included buses and cars, biking, and in some areas, Lyft and Uber. There was also a car sharing service that was in Seattle. Over 12,000 homeless people live in King County. The high homeless population in greater Seattle area in King County led to an interview with the CEO of Facing Homelessness, an organization that deals hands-on with homeless individuals. Facing Homelessness is a nonprofit organization that works with Seattle's homeless community to make connections between those that are sheltered and unsheltered. The CEO, Rex, believes that no one chooses homelessness, but individual circumstances bring them there. Rex believes in small acts of kindness that have a big impact on the homeless community, and also that negative stereotypes that we often hold about the homeless lead us to do nothing. Rex sees the responsibility being shifted to nonprofits, the government, and religious organizations when really, for changes to be made, it starts with the community. Rex started a campaign called Just Say Hello. The reason for that campaign is for people in the community to take a small step toward acknowledging homeless people with a simple hello. He believes this bridges the step between doing something and second interview was with Chris Middleton. Chris is an emergency room nurse at Harborview Hospital in Seattle, Washington. Harborview is a regional trauma and burn center for Washington, Alaska, Montana, and Idaho. Harborview also is a county hospital. Their mission is to serve the most vulnerable people in King County. This includes people who are uninsured or underinsured, homeless, those suffering from mental illness or drug addiction, and incarcerated people. Some of the homeless population tend to use Harborview ER as their primary care provider. In King County, the life expectancy is 80 years. Life expectancy is in the 95th percentile when compared to the rest of the U.S. King County ranks as one of the top counties in the U.S. regarding health status. There are discrepancies between the north and southern regions of the county. Residents to the north are expected to live 10% longer than residents to the south. Hispanics have the highest life expectancy at 86 years, while Pacific Islanders have the lowest at 75 years. On average, 7% of King County residents have been diagnosed with diabetes. asthma was diagnosed at an even higher rate. In King County, 9% of adults were diagnosed with asthma. Individuals considered low income were more often diagnosed than individuals living. The leading cause of death in King County is cardiovascular disease and cancer for adults 45 years of age and older. Suicide and injury was a leading cause of death among young children and teenagers. Asthma is a top public health issue and is one of the most common chronic diseases. Asthma use large amounts of healthcare resources and often have poor outcomes. Asthma is also the most common chronic disease for children. It has a large financial impact on individuals and the healthcare system. Hospitalizations are common, along with emergency room visits, both of which cost the public and private insurance companies billions each year. King County is very diverse when looking at income level, race, and the layout of the region. People with incomes lower than $15,000 were 2 times more likely to experience asthma compared to individuals that made over $50,000. Often people that suffer from asthma have substandard housing, are low income, are minorities, have other chronic conditions, and have mental health issues. Cases of children in King County that have asthma have been increasing. Environmental factors such as indoor and outdoor pollutants, genetics, poor access to care, incorrect usage of medication, lack of communication between patient and provider, stress, and lack of social support all contribute to risk factors for developing asthma. Individuals in King County that made $15,000 or less accounted for 17% of those diagnosed with asthma. Households making over $75,000 accounted for only 8% of asthma sufferers. King County has created multiple asthma programs. The first program is called King County Asthma Program. The program is a free service for adults and children and provides education regarding asthma and steps to take to lead healthier lives. The program teaches about asthma triggers and ways to control them. The program provides a free vacuum cleaner, cleaning kits, and dust covers. The second program is Healthy Homes 2, funded by the National Institute of Environmental Health Sciences. The focus of the program is to control asthma in 3 ways. First, a nurse provides asthma education that includes self-management and action plan and case management. The second part includes a nurse coming to the house to address triggers and how to control them. And the third part provides funds to improve ventilation, mold growth, lead, carpeting, and weatherization. The third program is the Allergy and Asthma Network. It is a prize-winning program that allows individuals to go online and find information on how to prevent and control asthma symptoms. The main purpose of the program is to end deaths caused by asthma using research, education, advocacy, and outreach methods. The county has considerable assets and community resources. Assets include community partnerships, service providers, educational opportunities, healthcare resources, housing opportunities, faith organizations, and the physical environment. King County 211 connects people with health and human service resources. This includes housing, financial assistance, food, health clinics, etc. Resources can be found online by calling 211 or email. Over 5,000 services are listed along with 1,500 agencies. The Department of Social and Health Services assists residents of King County in many ways. Assistance includes food, cash, and medical, housing, child support, youth services, adult care, mental health and addiction services, and disability support. Parent 123 is a resource that is useful for parents with children. A family hotline is available along with online resources. Online resources include food stamps, farmers markets, summer meals, and food banks. Low-cost immunization and free community clinics are also listed. King County Housing Authority, Wellspring Family Services, YWCA of King County will assist with affordable housing. Opportunities for education in King County are abundant. There are many community colleges and four-year colleges and universities. Healthcare resources are ample as well. Community clinics offer care around King County on a free or sliding scale. King County also has a variety of clinics where patients can gain access to free birth control, STD testing, and annual exams. King County has a public health dental clinic for individuals ages 13 and up. Changes in King County reduce use of contaminated needles. Individuals can drop off dirty, used needles in exchange for clean injection equipment. County has problems, these challenges can be overcome by embracing diversity, identifying specific needs, working with organizations, leaders, and local members of the community. Thank you.